Welcome to the Sustainable Dish Podcast. I'm Diana Rogers, a real food registered dietitian, author, and sustainability advocate. I co-host this podcast with James Connolly, who was a producer on my film, Sacred Cow. I also founded the Global Food Justice Alliance, an initiative advocating for the inclusion of animal source foods like meat, dairy, and eggs for a more nutritious, sustainable, and equitable worldwide food system. You can check it out and join me at globalfoodjustice.org. Thanks again for listening, and now on to our show. Welcome back to the podcast, everyone. I have never done a show on this topic, and I'm super excited to do it. So I've got Michelle Jorgensen with me today, and she is a natural dentist. How would you describe what you do, Michelle?
Well, there's a little bit of a longer story, but I call it health-based dentistry, but
Okay.
I'll get into a little bit more of the different versions that people may have heard of.
Sounds good. Yeah. So you were recommended because one of the folks that works for me is your son, who I adore. He's fantastic. Told me a little bit about some of the work that he had done for you, which he used as his like resume to work for me, and I was super impressed. And so I'm so curious to learn more. Let's get into first. How did you even come to do what you do today?
Yeah, great. My story is always an interesting point to start with. So just like my son Josh is now in medical school and going to be a naturopath, I have also followed along in the footsteps of my father, my grandfather, and my father's a dentist. And I actually have 3 younger brothers that are dentists as well.
Oh,
So
wow.
this is definitely in our family, but it was all traditional dentistry, traditional medicine. My grandfather was an internist, so traditional doctor. And that's how I started practicing. And that's just how I thought I would continue practicing for years. But about 8 years into practice, I started actually getting really sick. And I didn't know what it was. I started having a lot of gut problems, which I know you talk a lot about gut health and all of those kinds of things. And so nothing was on my radar other than just, lots of people have gut issues and this is just how you deal with it. So, of course, I started changing my diet. We started, removing packaged foods and processed foods and eating a lot more plants and, all the things everyone does. And it made some difference, but not a lot of difference. So I knew there was still something there. The big pieces, though, that were really alarming is my memory just started slipping. And I've always had a really good memory. I've always could remember patients, their entire stories. And I would see a patient in the office and I couldn't even remember their name. And it was so startling, the difference from what I used to do, that I knew something was really wrong. But the big one was my hands. I started having such numbness in my hands that I literally couldn't even hold the instruments I was supposed to be using anymore. I couldn't change out the burrs. I couldn't do what I needed to do. I would be awake all night long with my hands completely asleep. I couldn't blow dry my hair, brush my teeth, anything that would raise my arm up. So of course everyone thought, oh, this is carpal tunnel. It's called thoracic outlet syndrome, and so I went for all of those things, all the testing, all the x-rays, all the everything. And everybody said, no, I mean, it's kind of a problem, but it doesn't really explain what's going on. Chiropractor visits, massage therapists, and on and on and on and on. So finally, with no answers, I had my practice for sale. And, I was in my mid 30s at this point. Josh, actually, my son was, he was probably in his maybe junior high, if that. So we had a young family. My husband worked for the practice as well. And this was just really concerning because we thought, what in the world are we going to do for the rest of our lives now? This is where our income and our livelihood is coming from. So in speaking with another practitioner, he said, have you looked into mercury poisoning at all? You sound so much like me. And I hadn't even thought about it. That I said, well, I don't have any mercury fillings. I've never had a filling either. You shared with me you've never had a filling, neither have I. And so I didn't have any mercury fillings. And he said, no, it's not the fillings you have. It's the ones you've been drilling out for the last 10 years with no protection. And no one had ever said a word about this. And in all of my dental training, in all of my, decade or so in dentistry, my father in dentistry, no one had ever said that the mercury in those fillings being drilled out could be a problem. I was a cosmetic dentist. This was the thing I loved to do. So I was taking out all those fillings because they were ugly.
And inhaling
mercury vapors the entire time. No idea. So dentistry doesn't talk about this. The dental profession tells you this is basically the talk I learned in dental school is, yes, those fillings have mercury in them. It's completely stable, not a problem at all. And if you tell anybody that it could affect their health, you will lose your license. So you've now received the dental school talk about mercury fillings. And it really hasn't changed today. So I didn't know that this could be a problem, got tested, and sure enough, mercury toxicity off the charts. So all of a sudden, all of my symptoms made sense because mercury is a neurotoxin. So the numbness, the memory issues, all of these things, even the gut problems are 100% tied to mercury. So when I finally figured it out, I said, all right, get it out, get it out. What do we need to do? And the doctor said, well, you can't get it out while continuing to put it in. You won't get any better. So you've got to figure out, can you change the way you're removing these things if you're actually going to get better? So I had to go and research and say, well, is there a way to do this? And I found that there are organizations that have been based largely around this mercury issue. I didn't even know they existed. They already had protocols in place. And so I started following all their protocols, got the equipment necessary to be able to do this safely. And I just started doing it for myself. This was for my own health. And then I started thinking, well, gosh, this is good for the patient right now too. They're not breathing it all in or swallowing it all. And wow, this is probably good for my dental assistant that's sitting right here next to me. And oh, the hygienist that's in the room over, or the receptionist at the front, this is probably good for all of us. And so started thinking, wow, okay, I'm glad I found this. And then patients started saying, my doctor's actually been looking for somebody that does this. Can we tell them about you? So, of course, that'd be great. And so doctors started reaching out. And before long, they started asking me about other things I had also never heard of. Have you heard of ozone? Have you done this? Do you do this? I hadn't heard of any of these things. So to be able to work with them, I would say, well, let me go learn. Let me go find what it is you're talking about, because you obviously know about my profession more than I do. So let me go learn what it is. I'd have to go to all these obscure classes in different places. I mean, I learned ozone from a veterinary conference. I just had to go different places to try to learn these things, and eventually started thinking, wow, what else inside of my profession affects health that I didn't have a clue about? This is a little terrifying. So in the process, I wrote a book about this, and I've completely converted my practice. So now I employ 5 other doctors, and we provide basically health-based dentistry under one roof, where the focus is root cause. What is the cause for your illness? What is the cause for your chronic disease that you've not received answers to? Could it actually lie in the mouth? And I've been shocked. Research shows that 60 to 80% of chronic disease is either caused by or related to something in your mouth. So this has sent me on an entirely new quest to figure out answers for people who have not been able to find answers, because that was me. So
Are people still using mercury to make fillings? I don't know.
oh yeah. Oh yeah. Yep.
Why? Well, why?
Good question. So yeah, so anytime you hear silver fillings or amalgam fillings, those are 50% mercury. They have been 50% mercury since they were instituted, and they still are today. The reason is, well, it's a little bit, honestly, it's political and legal. So if there are other countries, multiple European nations, who completely banned it, they've outlawed it completely. Just in, I think it was 2019, the FDA did say that they should not be placed in pregnant women or children under the age of 6. So in the U.S., that is it's only it's not even a requirement. It's just a recommendation. However, a lot of times this is used in children because people think, well, this is an inexpensive filling material. It's easy to use in a kid because you can do it even when the mouth is wet. Like if there's saliva everywhere, sometimes the white fillings they're hard to do because they can't get wet. Well, it's hard on a moving target. So these are easy. You plug them in the hole, they work. But here's the other issue. If they were ever to, American Dental Association, FDA, were to come out and say these mercury fillings are dangerous, every dentist who's ever placed one would be under a class action lawsuit, because
Oh my
that's
gosh.
the country we live in. That's the way our country works. So our country cannot do it. Those organizations cannot and will not ever be able to say that. Other countries have. Like I said, many European nations have totally banned it, but the US can't, just because of the legal implications. So what that means is we have to be educated as consumers to say, okay, this isn't okay. These regulatory agencies can't say it, but we know it. So now what do we do instead? So there's a lot that I've learned.
Wow. So yeah, as entering this podcast, I told you I've never had a cavity. I my knowledge of dentistry is just consumer level, pretty much. So, but I'm imagining most people who are listening to this probably have had a cavity, maybe likely do have mercury filling. So, what do they do about it now?
Yeah, so I will often tell people it. So there's research, there's scores of research that shows actually that these fillings do release mercury day and night. They are nonstop releasing mercury. It's a low level, but a low level of, just because it's a low level, it doesn't mean it's not toxic. And unfortunately, mercury loves to lodge in the brain. It's one of its favorite places in the nerves. It also interferes with gut function. So you talk a lot about gut function. Mercury interferes with the binding of zinc, and zinc is necessary to create stomach acid. So if there's mercury that's free floating in the body, it will actually lead to low stomach acid, which leads to low absorption, which leads to probably a lot of the things that you already talked about.
Mm.
So one of the most important things is it is good to get it out, but it's actually more dangerous to get it out unsafely than to leave it be. So I will tell people that if you don't have a dentist that can remove this safely, leave it be for now, because it's actually worse to release all of that and let it loose in the body. You're going to have a lot of effects from that. So what do? There's an organization, and I can have you add this to show notes if you'd like at the end, called the IAOMT. They've researched this heavily, and they've created a series of protocols, things that you need to do when removing it. So it includes everything from getting your body ready to detox the mercury, all the way through the things that we use during the procedure. We have drapes that we put over your body, over your face. We put oxygen, on your nose so you're not breathing it in. We have special dams that catch the mercury and big old vacuums by the chin to catch it as it comes out. And anyway, a lot of different protocols. So there are dentists who have been trained in these methods, and there's a dentist finder on their website. So you can go on there and type in, where you live, and find someone who's actually been certified through this organization. And that's what I would recommend. Otherwise, leave them in until you can find one, because there's more risk of removing them unsafely than just getting the low level of constant mercury that you have right now. You need to wait till you can get it out safely.
And I've also heard that for people with heavy metal poisoning, same thing, that messing with it and trying to detox with a practitioner that is unfamiliar with it is can be quite dangerous. So I'm curious what you did did you do any kind of, is it chelation therapy, or how did you recover from the mercury yourself?
Yeah, I did real kind of light sort of treatments at the beginning with chlorella and some of some of the easier chelators. I They had told me that I would need IV chelation, which I've since learned is actually not the way to go about doing it with mercury. Um, and so I'm glad I didn't do it at that time, but I didn't have time to do it at the time either. They told me I would need 97 treatments of IVs. And I said, well, in what lifetime am I going to find 97 plus
Ouch.
hours to sit here in your office and do this? So I worked on a lot of other natural things, opening up my detox pathways, liver, kidney, getting everything really detoxing nicely. But it's been a slow process, and I'm actually currently just in a massive brain detox program right now, because I think I've detoxed my body pretty well. Mercury is interesting. It will move from high concentration to low concentration. So wherever it's highest in your body, it will stay there. So I got my body all cleared now really nicely. And so now I'm helping it move from my brain to the body, so then I could detox it there as well. So I am using some chelators right now to be able to dump whatever is left.
Wow. Wow. That's an amazing story. And what's the name of your book?
Healthy Mouth, Healthy You. And it
Wonderful.
really has some really good information, everything from it. I talk about, so you asked, okay, what is the kind of dentistry that I do? What is this even called? When I first started getting into this, the only term that I could figure out, and this was almost a decade ago now, the only term that really seemed to fit it all was holistic dentist. But what I found is that brought so much misnomer with it. When you use the term holistic, they think I'm going to be wearing tie dye, and I'm going to have like incense burners, and we're going to be saying peace, and like that's what we're going to be doing the whole time, and that we're not going to be based in science. That's usually what people assume when you say that. Well, that's completely 180 different from what my practice is. If you walk into my practice, you'll think, whoa, we just like got, this is like space age technology. We are on the cutting edge of everything when it comes to treatment, because we have to be, because we have to defend what we do, because we are not necessarily mainstream. So if we're not mainstream, we have to say, no, no, this is why we do it. And here's the 10 research articles that support what we do. So we are incredibly scientifically based. So holistic kind of fits, because holistic also means we're looking at the whole body, but it just brings this like hippie vibe that we are so not. And so I started using the term biologic. That's what a lot of dentists that are like me use, but nobody knows what that means. That's like, yeah, I mean, do you know what that means? Biologic dentist. It's like, no, no, sounds okay. So, we started using that. Health-based makes a lot more sense. Now we're calling ourselves functional dentists, because people know about functional medicine, that it's all root cause based. And so we're trending towards that we're functional and integrative dentists. We're bringing all the things that really help the body be healthy all under one roof. We talk a ton about the things you talk about with nutrition. That's huge in our world, because that honestly is one of the very baselines for tooth decay is nutrition.
Yeah, I have a new dentist. His name's actually Steve Martin, which is kind of funny.
That is funny.
And he was asking me what I do for work, and when I told him that I do nutrition and that I focus on the importance of animal source foods, he was like jumping up and down, so excited, more than any other medical professional I've met, because he's seen the damages that a vegan diet does to the mouth. And I know, for those listeners of mine that are familiar with Chris Masterjohn, he is a nutrition PhD that does a lot of research. And when he was vegan, he developed like just gaping holes in his teeth. So can you talk a little bit about the importance of nutrition, and specifically about animal source foods, when it comes to cavities and oral health?
Yeah, and the starting point of this is Dr. Weston Price, which is
Hmm.
interesting, because so many people in the nutrition world know Dr. Price, but they may not always know that he was a dentist. So
Yeah, yeah. Please talk a little bit more, because I actually haven't done a podcast talking about his work in a long time.
yeah, it's fabulous. So he was a dentist in the 1930s, and he was actually head of the American Dental Association Research Department. So
No, I
he
did
was
not know that.
yeah,
Wow.
he was huge in research in the American Dental Association. So at that time, this was very mainstream. Now you are lucky to have found a dentist who knew anything about fat soluble vitamins, who knew anything about plant, animal source nutrients, because very few dentists actually even know anything about this. But he was a dentist, and it's interesting. He was dismayed at the amount of tooth decay he was seeing, particularly in children. And I always kind of chuckle and think, well, what would he think today? Because actually, tooth decay has increased since the 1930s. So it's even worse today. But he decided he and his wife went on a world tour to find indigenous societies that had not been touched by the modern diet. And so they were eating the things that they had been eating for centuries. And I like to say that he was at the perfect time for two reasons. Number one, there still were indigenous societies that had not been touched by the modern diet, because we couldn't find them today. If we were to go and investigate and research, we couldn't actually find these little pockets of people today. But the second thing that was beautiful is that he had a camera, and he was able to photograph his findings, which makes them so much more profound to look at what he found. So as he went through all these different societies, and he was going to Aborigines and Inuits in Alaska, and people in Switzerland, and all these different pockets of places, they were eating different foods. What he wanted to see is, how did diet equate to health? And he looked particularly at tooth health, face development, so growth and development in the face, but also he was looking at overall health. And the little pockets of societies that he found that had the best overall health had commonalities. They weren't eating the same things, because obviously you have people eating whale blubber in Alaska and people in Switzerland eating, cream from grass-fed cows. But what he found is that there were commonalities of nutrients in the foods that they were eating. And the commonality was they had 4 times the amount of water soluble vitamins, which the primary one of that is vitamin C, but 10 times the amount of fat soluble vitamins. So those are the vitamins A, D, E, and K. And those vitamins can largely only be found in animal sources. So he was finding them in the blubber or in the cream or in the meat itself. That's where he was finding these vitamins. And the people that were most healthy had 10 times the levels of people in the US at the time of those vitamins. Now, again, I often will say, what do you think it would be today? I would think it would be probably multiplied by that, not just 10 times more, but probably significantly more than that, even than what we're eating today. And in those societies, he found health, dental health, growth and development health, and overall health.
Yeah, and I should add that his hypothesis when he set out on this world tour was actually that it was the meat that was the problem. Like his initial idea was that a vegetarian diet was the healthiest, and he was pretty shocked at what he found. And so, anyone who's listening that wants to see these photos, it's the book is called, I believe, is called Nutrition and Physical Degeneration.
Yep. And there's a
Yeah.
Weston Price Foundation online you can
Yeah.
look at, and they have all of these. If you even just Google Weston Price, you're going to see a whole bunch of photos that he took.
Yeah.
Like I said, the photos are really, really priceless in this research that he did.
Yeah. Yeah, so I'm so glad you brought him up. I do think sometimes this idea of, well, raw milk is the panacea is not necessary. That gets a little too heavy sometimes
Yeah.
from just as somebody who doesn't necessarily think you have to drink milk to be healthy. But this idea that it's animal source foods as the most nutrient dense foods is definitely in line with my philosophy for sure.
And a lot of the people weren't drinking milk. And
Yeah.
so it wasn't the milk that was the answer, it was the fat soluble vitamin that was the
Mhm.
answer. And I
Mhm.
talk about this with people all the time. What he found, in fact, there was one family that was particularly interesting. There were two brothers, and one of the brothers had maintained his the indigenous eating, the cultural eating of his ancestors. He was eating the way that his parents and grandparents were eating. The younger brother actually started eating processed foods, and they said it was things like jams and candies and sugary drinks. He had started adding those things into his diet, and the difference in those two boys was startling because they had the same genetics. They had the same family, same environment they were living in, but the food was the only difference. And the younger brother had already lost multiple teeth. His face, even the growth and development of his face, was much longer and more narrow, which I can talk about that. There's a huge component actually that goes into this growth and development. In fact, that probably would be good to talk about. But I do want to finish up. Why is it important to have cavities or to have these nutrients? What Weston Price found is that these nutrients led to cavity resistant teeth. So he noticed two primary things that really showed up with these people who were eating these diets. Number one, they did not have tooth decay. They just didn't. And it wasn't because they had fluoride. That's a whole nother talk I can give about, do we need to do fluoride? No. Teeth don't have fluoride, and these people did not have fluoride. That's not the reason. It's because they were building cavity resistant teeth. And the reason that works is kind of like the idea of an umbrella. So an umbrella has tightly woven fabric that makes it water resistant. Well, in the tooth itself, in the outside layer of the tooth, it's called enamel, and there are minerals in that layer. It's called hydroxyapatite. It's the crystal structure that those minerals are in inside that enamel. Well, if that enamel is full of minerals, it's like that tightly woven fabric on an umbrella, and it will literally repel things from the tooth. So if there's enough minerals there, then you cannot get a cavity, almost regardless of what you eat. If you eat enough sugar, it's going to change actually the blood sugar balance of calcium phosphorus. It'll pull minerals from your bones. Like, it'll cause all sorts of issues. So it's not just the fact that it's sugar, but it's just that the tooth itself is cavity resistant. So why do the fat soluble vitamins matter? Well, fat soluble vitamins are the things that grab the minerals and enable them to get into the cell. So the way I discuss it is that vitamin D grabs the calcium out of the blood, and vitamin K2 puts it into the cell. And interesting enough, they did not have vitamin K2. It had not been identified when Dr. Price wrote this book. So he called it activator X. He didn't know what it was. but he just called it Activator X. Well, they've since named it vitamin K2, which I wouldn't because it's confusing with vitamin K1, which is a very different vitamin. But vitamin K2 is the one that actually puts it in the cell. So you have to have minerals available, but you must have the fat soluble vitamins in order to actually incorporate the minerals where they belong. So that's the connection between Dr. Weston Price and cavity resistant teeth. And it's actually pretty huge.
Yeah. And the reason why you need to eat whole food in its whole form and not just take a bunch of supplements and hope for the best. Do you often suffer from headaches, muscle cramps, fatigue, or sleeplessness? It could be from an electrolyte deficiency. Drinking plain water may not be enough to replenish lost electrolytes, which is especially important for athletes, kids, breastfeeding moms, those who are on a low-carb diet, and it can help regulate appetite. Element was created by my co-author and good friend, Rob Wolf, and is free of artificial ingredients, food coloring, gluten, fillers, and sugar. To put it simply, Element is a drink mix that has everything you need and nothing you don't. Even U.S. Olympic athletes rely on Element, and I personally recommend it to everyone in my nutrition practice. I love the raspberry and citrus flavors, and when you buy via my link, you'll get a free sample pack of a variety of flavors for you to try. Plus, they have a convenient subscription program that makes it easy for you to keep your favorite flavors fully supplied. Head over to sustainabledish.com/LMNT to give it a try. That's sustainabledish.com/LMNT.
From Whole Foods anymore. They're just so vitamin deficient. And so often I'll recommend a little bit of both. You should take a vitamin D and vitamin K supplement along with all of the food types that you recommend that are full of those vitamins as well, just to make sure you're getting enough. Because in our factory farmed world, it's often difficult. The vitamin K2 comes through grass. So if you have an animal that's only been fed grain, they actually won't have vitamin K2 in their tissues either. So they have to have been fed green growing something in order to have the K2 in their tissue for you to be able to get the K2 from them. So these are some tricky things in our food sources today.
Interesting. And so that would be mostly from dairy products?
Dairy or meat or any of those things that come from any animal. So an animal that has to have eaten something that contains vitamin K2 to be able to have K2 available for you.
Interesting. I have some friends that are doing some research right now into well, in the case of beef cattle, they are getting grass in the beginning. They're just finished on a feedlot, but dairy cattle, it's a little bit different. So I'd be curious with looking at feedlot cattle versus dairy, conventional dairy cattle, and seeing the K2 difference there.
Yeah, it will be different. That's why I recommend the Kerrygold butter, because that is from grass-fed cows.
Can you talk a little bit about what is a cavity, and you talked a little bit about how to prevent them, but what causes a cavity to begin with?
Yep. So the tooth itself, like I said, the outside layer is called enamel and it's full of minerals. And there's different things in the body that can change the minerals, that can actually leach or pull the minerals from the tooth. So number one, it could be acid on the tooth itself. So if you're just swigging Diet Coke all day long and you can say, oh, there's no sugar in it. Well, no, but guess what it's full of? Acid. It's carbonic acid. So any acid will actually dissolve minerals. You've seen these experiments where they'll pour Coke on the top of the terminals on a car battery, and it just literally dissolves all the mineral buildup and crud. It does the same with your tooth. It will dissolve minerals. But so does other acid like lemon juice. Some people think, oh gosh, I was taught I should be drinking lemon juice at the beginning of every day. That's not a bad thing to alkalize your own system. But if you continually bathe your teeth in lemon juice, it's the same as if you're bathing your teeth in Diet Coke. It's acid. So it will pull the minerals out of the tooth. So will acidic foods. But the main cause of acid is actually bacteria on the teeth when they eat sugar. So this is the reason they say sugar equals cavities. It's not sugar that causes the problem. It's the bacteria on the teeth. So that's why we tell you brush your teeth, because then that gets the bacteria off. If the bacteria stay there and they consume sugar, you fed them sugar, they eat it, their byproduct is acid. So if the bacteria eats, poops basically on your tooth, it's going to poop acid and it's going to dissolve the minerals in the tooth. So there's a lot of other bodily functions as well. If your body is deficient in minerals, so we see this in pregnant women, we see this in people who are nursing or breastfeeding their babies or growing teenagers. The demand for minerals is high. Like you got a growing person inside of you right now, or you are a growing person and you're growing tall and you need all these minerals. If you don't have enough because you're not eating properly, all the things you teach them to do, then your body will actually find minerals somewhere to be able to use for its processes. And the teeth are a ready-made bank of minerals. So your body will also change the balance of things in your own system and will leach minerals from your teeth to feed your bones or your baby's bones or whatever it might be as well. So any of these processes can pull minerals out of the tooth. When the minerals are pulled out, it leaves a hole inside of that mineral matrix, and bacteria crawl in. Then it's harder to get them cleaned out because they're inside of that hole now. So they sit in there, they eat the sugar again, they poop out the acid, it makes a bigger hole, they crawl in deeper. And so really all a cavity is just bacteria that have invaded deep into the tooth. And if they go far enough, they're going to kill the tooth. So that's what a cavity is, which is why we talk about adding minerals back in, adding minerals through your diet, adding minerals to your teeth. In so many different ways. I have a remineralizing tooth powder that I have now that will add minerals right to the outside of the tooth to make it more resistant. We have a remineralization kit, which is minerals and vitamin D and K that help from the inside to add minerals back in. We encourage healthy diets, all those kinds of things, because if that bacteria is just in the outside layer, just in that enamel, inside the crystal still, if you add enough minerals in, you can actually seal that tooth back off and in essence heal that cavity.
Wow, that's amazing. And so if someone is going to a typical dentist who might be doing mercury-based fillings for cavities, can they ask for something different or do they have to switch dentists?
No, I would say large majority of dentists now will give you an option. So the other option is something called a resin filling, and it's a glass resin mixture, and the large majority will. So any filling that's white color is going to be that material. It won't have mercury in it. But if it's still in the outside layer of the tooth, try to remineralize it. Try to put minerals back in. Don't even get it filled. Once it's extended into the inside layer of the tooth, which is called dentin, you do need to get it filled. So that's when you look for a dentist who will do the resin or composite. Composite's another name for it. A resin or composite filling to be able to clean out that bacteria, seal it all up, and then you hit the minerals hard so that you don't get another one.
And then other than, a typical whole foods type diet that I recommend, are there certain foods that you strongly recommend that maybe people could focus a little bit more on?
Largely the ones you do talk about, the
Okay.
ones that have fat soluble vitamins, the fats in them. One thing if people are vegetarian, vegan are challenging. I will say some of the worst teeth I've ever seen are those that are from vegan patients. And they're often the ones that are most health conscious. So they're very frustrated because they're like, I am working so hard. I'm killing myself to eat like this. And I'm like, well, unfortunately, it's not doing you favors. You feel good. Typically people on a vegan diet feel good for 3 to 6 months or so. They feel great. Like their body's like dumping all sorts of stuff. They feel great. And then things start to fall apart, including the teeth, including the mouth.
Yeah.
So if you're starting that way or you've been largely plant-based, things that I recommend adding that are easy are butter. Again, Kerrygold butter, chock full of vitamin D and K, wonderful. Eggs, particularly the egg yolks, have D and K as well, pasture-raised, because the others don't have much of anything in them anymore. Again, the chicken has to have eaten something that has it in it to be able to have it for you. People don't equate this very often. They're like, oh, well, where does the egg get the nutrients from? Well, it just doesn't appear. The chicken gets the nutrients from the food they eat. So the chicken has to be eating food that has that in it to be able to create an egg that has that in it for you. So these are the reasons that the sources for this are so important. Unless they're eating it, they don't have it either. So they can't give it to you. So egg yolks are important. Cod liver oil, that's one that people have talked a lot about for decades. Cod liver oil is a really rich source of this. Bone broth is another really great source of it. Those are all things I recommend. Fish are a fabulous source of these vitamins that you need. So I'm sure you talk about all of these things.
Oh, definitely. Yeah. And so let's move on to root canals and hidden infections and the ramifications of that and how to deal with it.
Yep. So if the cavity extends to the nerve of the tooth, the way a tooth works is it's a closed system. So there's a nerve and a blood vessel on the inside of the tooth. And once infected, so if the bacteria have moved all the way to that blood vessel and nerve, it will kill the nerve tissue and blood vessel tissue inside of that tooth. And that's when you get a toothache, an abscess tooth, swelling, all those kinds of things are because the nerve on the inside of the tooth is actually dead because of most likely bacteria. Sometimes it's trauma. If you break your tooth off, it'll sometimes kill the tooth too. So what's been recommended has been a root canal. And this came about in the late 1800s. People were tired of pulling teeth. It was the only option. And honestly, pulling a tooth without being able to get someone numb, I can't even imagine. This is largely barbers doing this too. So they figured out that they could clean out the inside of the tooth and put filling material on the inside where that nerve and blood vessel tissue was, and the tooth could stay there. Well, the concept of it is fabulous. Like being able to retain the tooth in the mouth, you put a crown or something over top of it, it still chews, it still smiles, it still functions. I mean, the idea is wonderful. The trouble is that on the inside of the tooth, it's just like everywhere in the body. You know how in our body we have big blood vessels? We have big blood vessels, then we have the teeny little capillaries. So the big ones go to the main area, and then there's the tiny little ones that go out clear to the end of our fingertips and the end of our toes. The same thing happens in the tooth. There's the main channel inside of the tooth, but then there's tiny little channels that go off all the way to the outside of the tooth. That's how the tooth gets the minerals that you've been feeding it. It has to go along these tiny little pathways. Well, when a root canal is done, they can clean the inside of the tooth really well, that main big blood vessel nerve channel, super well. They clean it, they disinfect it, they fill it up. But it's impossible to clean all of those little side channels. You can ask any dentist and they will tell you this is true. It's impossible to clean all those little side channels. So now you have dead tissue, dead nerve tissue, dead blood vessel tissue. Well, bacteria love dead stuff. I tell people all the time, if you have a pile of garbage on the ground, how long before there's bugs in it? Days. I mean, mere days, and that's full of bugs. So bacteria love dead stuff. So they will find that dead tissue inside of that tooth and they will reinfect it. Now what it's doing is it's asking your immune system to keep it healthy, to keep that infection at bay. So what we see is a huge correlation between chronic disease and root canal teeth. And this is why. This is the why. Because it taxes your immune system to keep that tooth healthy. It taxes your immune system, and those bacteria, even though they perhaps haven't gotten huge yet, they are spreading. Every time you chew on that tooth, you're in essence sending those bacteria through the bloodstream to the rest of the body as well. So everything is connected top to bottom, and there's an enormous connection between root canals and cancer, particularly breast cancer, interestingly enough, between heart disease. There was a crazy study that showed that over 70% of the clots that actually killed someone in a heart attack had mouth-only bugs in them. Like it's huge connection. It's not just little, it's huge. So what do you do? And what do you do? Because these are often silent infections. The nerve's gone, it doesn't hurt anymore. And I will find someone who has a failed root canal. They have no idea it's there. It doesn't hurt at all. And there's a cyst the size of a ping pong ball in their sinus from this failed root canal. All they know is they've got a sinus issue. They don't have a clue that it's actually the tooth that's causing it. So when we show it to them, or a hole in their head, like somebody shot a bullet through their face because it's eaten all of the bone away around the end of the root. I mean, crazy stuff I see every single day. And they're sick. They're sick and they can't find answers and they don't know why. And I take their CT scan and I go, well, this might be why. So that's the big one, is how do you find these things? So we use a dental specific CT scan called a cone beam CT scan. Oral surgeons often have them. More and more dentists are getting them. We can identify these infections on those scans. And it's crucial. We do this for every new patient because we are shocked at how many of these infections we find that are affecting them and making them sick, and they don't even know they're there.
And so, so what is your protocol then once you find this?
So once a tooth is dead and it's infected, there's only one thing we can do. You can retreat, you can redo the root canal. But I tell people, why? Because all they're going to do is take out the filling material and put it back in. It's not going to get to the root cause. It's not going to get to those little side channels that are impossible to clean. Some people do choose to have them retreated. It might buy them a couple of years, but I always say, what is it costing you in those couple of years of immune system? But that's always their choice. So the only option that takes care of the problem and has it gone is to remove and replace the tooth. Nobody likes to hear that, but it's funny because anymore my patients have heard me talk about this so much on social media or wherever it might be that they come in telling me ahead of time, I know, I'm just going to have it taken out. I'm like, well, I'm glad that you gave yourself the bad news before I had to. But we can replace teeth. We can replace them with ceramic dental implants. I have a dental implant right here. It's like it chews like a tooth. It smiles like a tooth. It's like I never lost my tooth, and I don't have to worry about it taking me out, taking my health away.
Anything else? Gum disease tips? Any other thoughts you could have for the novice, concerned, health conscious person who wants to know more about dental health?
One of the things that I talk about a lot that we'll take it back to Weston Price here a little bit. So one thing that he noticed is that faces were not growing the same when people stopped eating these fat soluble vitamins and the foods that contained them. What he found is that people's faces started being a lot thinner. They started having crooked and crowded teeth. Or some of these societies, no one had crooked teeth ever. Well, how many people do you know that have braces? I mean, almost everybody, right? Well, why does everybody have braces? And how many people do you know have had their wisdom teeth removed? Almost everybody, right? Why? Our mouths have gotten smaller. And because it used to be, and we look at skulls of, people who've died centuries ago, and their mouths contained all 32 teeth, all of the wisdom teeth, everything had plenty of room to fit, and they were straight. So what's happened? Well, as we've changed our diets, the bones have not grown as strong. And the first bone that's affected by malnutrition is actually the upper jaw. So this is proven. The maxilla is the first bone affected by nutrition. So if as an infant, or even if the baby isn't breastfed or doesn't have good nutrition as an infant, the jaw grows too small. The tongue grows too. Everything's changed in the growth and development. And what happens is oftentimes the tongue and everything else that should fit in the mouth can't. And so it falls backwards into the throat. What we've seen is a rash of children who have ADHD, who have bedwetting, who have focus issues, who have growth and development problems and crooked teeth. What is this? These are mouths that are not growing properly, and it's leading to children not being able to breathe adequately when they're sleeping. If your child fits any of these categories, you need to look into growth and expansion appliances. There's things that they can do while growing to direct their growth in order to have enough room to breathe. Because if that child doesn't get enough room to breathe, what it turns into is an adult with enormous issues with sleeping, sleep apnea, insomnia, all sorts of things. You can try every sleep hack in the book, but if you simply don't have enough room for everything to fit in the back of the mouth, it won't. So this is one of the things that Weston Price was finding, is that as nutrition changed in today's diets, not only the level of nutrition and the vitamins and things in the food, but also the kinds of foods. So when we feed babies soft foods, things that don't actually require a lot of chewing or a lot of muscle development, the face doesn't develop. So I'm so glad to see the trends. I have a little grandbaby and they let her eat like steak. I watch it and I, have a little panic because I'm like the old lady who goes, we don't feed babies that, but they're feeding their baby this, and it's getting her muscles working and her face is developing and her jaws are doing what they should do. We have entire generations of people whose faces aren't right because we didn't give them the right food. So we've got to give them the right food. We can affect the growth and development. Even an adult, we can fix you if you can't breathe. I can fix you if you can't sleep. We can make things bigger and give you enough room to breathe again. But this is an enormous one that relates back to nutrition and shows up in literally every day of your life if you can't breathe.
Yeah, wonderful. Well, thank you so much. Let people know where they can find your website, your book, learn more about the work you do. And what was the name of the website again that you mentioned where they can find You're in Utah, is that correct?
I'm in Utah, correct. We do virtual consults for people all over the world. If you're interested, there's information. So my website is Total Care Dental. So Total Care Dental. And on Instagram, social media, anywhere you want to look for us, we're Total Care Dental Utah. So you can look that up. But I also have another outreach. As I really started to teach people about these nutrition aspects, I wanted to do it in a way that I live at home. So I have a homestead. We grow our own, we raise our own food, all of these things here, and make our own medicines. And so I teach that also through a platform called Living Well with Dr. Michelle. So that's the website, that's the Instagram, social media, everywhere, Living Well with Dr. Michelle. Check that out. So much information there on everything. People are always like, oh my gosh, I'm so glad I found you. There's so many little tidbits and things that I love on here. So check that out. The books can be found on the websites, but also on Amazon. Healthy Mouth, Healthy You is my dental book. I also have 4 other books on nutrition and self-sufficient living, all of those kinds of things. If you're looking for a dentist near you, check out IAOMT.org, and that is where you can find a dentist finder of someone near you.
Wow, you're like the dental version of me. So cool.
Exactly. Yep.
That's awesome. Well, I really, really enjoyed our conversation. Thank you so much for your time. And I hope everyone goes and checks out your stuff. So thank you.
Thank you.
Thanks so much for listening to the Sustainable Dish podcast. If you like the show, please leave a review on iTunes. And if you'd like to support the work I'm doing on Patreon, please visit sustainabledish.com/join. As a Patreon subscriber, you'll get access to ad-free podcasts, plus exclusive video podcasts, never-before-seen interviews, and a discussion community. Go to sustainabledish.com/join, and thank you for your support.